The illegal U.S. prescription drug market is supplied almost entirely domestically by the legal prescription drug market. Essentially, people, through a whole series of mechanisms, either selling off drugs they were prescribed, people engaging in doctor shopping where they go to multiple doctors to get drugs like OxyContin, for example. This feeds the illicit prescription drug market. It's almost entirely domestic, but I wanted to think about what I consider a fairly low probability scenario in which these drugs were supplied by transnational criminal organizations. And there is an example where it is possible that a largely domestic drug problem could turn transnational, and that's with the meth analogy. If we look at the 1990s and early 2000s, methamphetamine was primarily produced domestically in the United States, and it was the chemical precursors like pseudoephedrine were bought over the counter decongestants, and they were smurfed. Individuals would buy small amounts and then sell them to a cook that would cook methamphetamine, and that fed the domestic methamphetamine market. But what happened was sufficient controls were put over pseudoephedrine and over-the-counter decongestants, and that market was pushed down into Mexico. And so what the Mexican drug trafficking organizations did was they imported from India and China, and they produced labs that then produced the methamphetamine and then trafficked those into the United States along their existing distribution networks. Something similar could happen in the United States in the context of if domestic controls on pharmacies and the medical healthcare system became sufficiently tight to starve that market. We could see Mexican drug trafficking organizations taking on that market and importing those drugs and then transporting them into the United States using their existing distribution networks.
In recent times, we have learned that legal prescription drugs have become a major drug addiction problem in the United States, surpassing even those drugs that are generally considered illegal. I think that in that sense, we have a problem because we have to begin to consider that addiction is the real problem, whether it is to legal substances such as tobacco, alcohol, or prescription drugs, to illegal substances such as marijuana and other harder drugs, or even some habits such as sex, shopping, and such things. I think that we will not be able to succeed in the war on drugs if we do not consider that this is a war on addiction, and we begin to adopt a series of solutions that include healthcare, mental health, and other such things. If we criminalize the addiction to prescription drugs, we will be compounding the costs. Mental health will continue to deteriorate among those individuals that will be targeted for criminal investigation and prosecution. We will compound the losses to the workplace, and we will increase the prison population. If we criminalize these drugs, we will simply begin to expand what the war on drugs has been up to now. In that sense, I think we have to consider the alternatives. That is, to invest in research on drug addiction itself and the proclivities or the propension to these diseases that individuals have, and begin to treat mental health. We have done it successfully with other habits that involve moral judgments, such as diabetes and the way we eat, such as HIV and our sexual habits, and cancer and the kinds of substances that we ingest. In that sense, I think we need to begin to deal with this as a matter of mental health and education and prevention instead of crime.
The prescription drug abuse problem in our country is somewhat of a recent phenomenon. By that I mean in the last decade or so. In 2011, there was a national survey on drug abuse and health that was conducted, and more than 70% of it was determined that about 70% of the people that abuse prescription drugs got them from friends or relatives. So that's kind of an alarming statistic of the degree to which prescription or pharmaceutical drugs are being used. It's a problem that does not reach media attention very much, and it doesn't reach policymakers' attention as well, as compared to the harder drugs, relatively speaking, like cocaine, methamphetamine, heroin, things of that nature. It is a part of the National Drug Control Strategy without question, but it just doesn't receive as much as attention because I think, comparatively speaking, drug abusers are using those other type drugs more than pharmaceutical drugs, even though it is a pharmaceutical drug abuse is a significant problem. What to do about it? Well, DEA is taking the lead in this, and they have encouraged people to return unused drugs, and they have a national take-back program that they've been operating for several years that has been very effective. In December 26th, this past year, 2011, DEA proposed new regulations for disposing of controlled substances, specifically pharmaceutical drugs. And it should follow the same experience that we had in the past, and that is that there will be a tremendous amount of drugs returned by the public to the extent of tons and tons of pharmaceutical drugs being returned. Thank you.